Hello, welcome to Mod Midwives, a Metro Midwifery podcast. I'm Gina Gerboth.
And I'm Nedra and we are home birth midwives serving the Denver metro area.
Welcome to the new week, the new podcast. So you've had a busy day. What have you been up to today?
I am car shopping because my car is used up that I'm driving right now.
Yeah.
So I'm a little terrified because I like not having a car payment. So
yeah. I've had a car payment for a little while now, and I'm used to it, but yeah, it's a drag.
It's an interesting experience because, you know, they're doing COVID stuff. So everything is over email, and that's nice, but weird because there's just like a communication gap. Yeah. But let me tell you, it's better than sitting in the dealership. I hate that too.
Oh my gosh, yes. Yeah. I had my car serviced today at the same dealership, I think, and it was great. They came and picked up my car and took it, and they said, they said, leave a note. Where do you want to leave it? Where do you want to put the keys? And so I just made a little plan for them. And
wow.
Yeah.
That's cool.
They texted me when they were on their way so I could pull it out of the garage, and they took it back and did the service and brought it back home to me.
Oh, that's super cool.
It was awesome.
I hope that goes on forever. Not
too.
COVID, but I hope
no. No, speaking of COVID. Oh, but he did say they were planning to continue it. So,
oh, good.
I mean, I think it's just, we just don't know when COVID stuff will settle down. So it's just kind of the new normal for right now, I guess.
Oh, yes. Well, yeah. I mean, looking in the future, what is it going to look like? I have no idea.
Yeah. So today's topic is actually COVID. I think we're just going to update what's been going on in our practice and all of that. But, I teach epidemiology at Midwives College of Utah, and I sent the students a really interesting article that talked about kind of 3 possible trajectories for COVID. It was basically kind of like, we have the big peak now, and then we continue really careful measures and continue to have a low. There will always be a number of cases now, but where it stays stable from here on out. The other one, of course, is the one that we're seeing modeled more frequently, which is the idea that we'll have 2 big peaks. We'll have a recurrence in the fall, or maybe even into the winter, where we have another big peak like we did in April. And then another is kind of like lots of little peaks, just where we just,
like that wave. I don't remember what the name of that wave is, but I saw a model, where it's just like, just like a,
is that a sine wave? Is it a sine wave? I don't.
Maybe.
I don't know it.
I can't remember the name of it, but it's like a super long wave that kind of like rolls on its own power.
Yep.
Yeah, but it doesn't have really high peaks.
But kind of like they're all lower. Like we do it, we have a little peak and people tighten up, and then we have a little improvement, and then we relax, and then we have another little wave and people tighten up, and it just kind of keeps going on like that. I thought it was really interesting. Of course, nobody really knows. They're, mathematical models that, they're prediction models. Nobody knows for sure. And of course, it's all dependent on what people actually do.
Right. There's millions of variables.
Yes.
Maybe billions, in fact.
There's billions of variables, because there's multiple variables per individual, and there's billions of people. So
true. Oh my gosh. Crazy.
Yeah. So, how are you doing with the new normal in your own life?
I feel pretty good the last couple of weeks. I feel like maybe I'm just getting used to it, I guess. I have gone on a couple of runs into a store for something I needed, which I hadn't done in a long time. And I still feel uncomfortable doing that, but I do the mask and the gloves. And I know people criticize people who wear gloves and make fun of them and stuff, but some people do know how to wear gloves and take them off and not contaminate themselves, and I am one of those people. So
I think some of the criticism is that people don't necessarily know they're using the gloves like their hands and then touching their face with the gloves.
Right, or they're like touching their purse or whatever, and I have a system, and I do not contaminate stuff with
Mhm.
my gloves.
I think the mask usage is also interesting. I see people struggling with how to wear a mask.
Yes. Yeah.
A lot of touching it, a lot of fiddling
Yeah.
with it, pulling it up and down. You know, I think
Yeah.
there's a little difference. The cloth masks, I think we should talk about masks a little bit.
Okay.
You know, I think there's a lot of confusion and a lot of criticism about the recommendations to wear cloth masks when you're out in public. And I just think it has to be reiterated that the point of the cloth masks is not to prevent the wearer. It's to prevent people from spreading an infection that they don't know they have, either A or pre-symptomatic infections.
Right.
I don't know why my light is like, I don't know if somebody's like turning on the blender upstairs or something.
I can't see it. So
There's
hopefully
lots of light flickering happening in my house. Sorry. For you YouTube viewers, you get to see a little bit of that.
If you were in my house, we would be blaming it on ghosts. So.
I'm blaming our mid-century electrical system.
We have 3 new ghosts today, by the way, because we lost 3.
Your tadpoles. Oh, great.
Yes.
Tadpole ghosts.
Yes.
I hope they don't smell bad.
I know, me too.
Anyway, so the purpose of the cloth mask is to protect other people. And I think that's where you've seen these memes that talk about it really is a sign of solidarity. It's a symbol that you care about others. And it is effective from preventing your droplets from spreading elsewhere.
Right.
It's somewhat effective in protecting you too. It is not as effective as the higher level medical masks that we would have. Even the surgical masks are not that protective. And so I saw this conversation about masks on a Facebook group, which I really need to stop. I need to stop.
I know. It's so awful because I need the social media to stay on top of current events, but it is so depressing and infuriating to see the things that people say. It just makes my
actually
stomach
horrifying.
sick.
It's horrifying.
Yeah.
But it was a group of midwives, and somebody said something about masks, you know, are they even effective? And I think there's so many variables. What kind of mask? How is it made? How is it being worn? Right. But if masks weren't effective, they wouldn't be worn in surgery. Right. So remember that the surgical masks are protecting the patient whose body is open, who has an open body cavity. Right. And that is very clear example of why surgical masks or a cloth mask would help protect other people. It is not about your own personal protection.
Right.
Yeah.
Which is a totally, like, full stop, totally enough of a reason to wear a mask when you go out.
Absolutely.
mean, and the fact that there is probably some, bit of protection for myself, that's nice, but it is really about the other people. And I feel really sad when I go into a place and there's 60% of the people not wearing masks or more.
Right.
So.
I will say this, I'm not wearing one when I'm exercising. I'm exercising outside, and mostly in my neighborhood. When I'm in my neighborhood, it's very easy to cross the street and not even be on the same sidewalk as somebody else. I have been for a couple walks around our office, which is a little more densely populated, and I've had people come up behind me on the sidewalk, and I wasn't wearing a mask, and I felt bad about that, although they shouldn't be coming up behind me on the sidewalk.
Right.
If they were jogging and going faster than me, they should give me birth,
Right.
Go around. It's very easy to stay 10 feet away from each other outside. And of course it dilutes the particulates and droplets and all of that being out in the fresh air.
I do have a bandana on when I'm out exercising, but I do find it challenging. And I've just put it up, like, if I see a person coming or hear a person coming up behind me. But it isn't great. It is a little bit warm, and, I certainly couldn't have it on the whole time or I would pass out.
Yeah. I would struggle with the walking for exercise, but I could do it, but I absolutely cannot jog.
No,
with
running.
Can't do it.
No way.
Can't do it. I need all of the
Yeah.
oxygen because I'm already struggling when I'm jogging.
Yes, me
It's not
too.
easy. But I did read a pretty encouraging article about probably runners and bicyclists are not, that there's probably not a lot of transmission happening there.
Oh, really?
But every little
Because
bit is
I'm picturing like all of
because they're
this
breathing heavily.
aerosol coming out of their mouth from the
It
heavy
is
breathing.
an article by an epidemiologist, I think. I'll see if I can find it for the blog post to have the notes, but it talks about the time that you need to be in contact and the density of the particulates, and it's a big equation, and because there's such quick passage, you're passing each other pretty quickly and you're outside.
See, when I pass a runner, I keep my mask on for like 50 feet after I pass them.
Until you've
I'm
gone past where
I'm picturing like the air is full of COVID spots.
It's probably not too bad. I think we can take some comfort in walking outside. That being said, so many people are out on trails right now. And I found myself on a trail on Sunday or Saturday and didn't have very much. I didn't have much in the way of protection, and because I didn't think anyone was going to be there, and then there were a lot of people, so I was a little uncomfortable and embarrassed that I hadn't prepared quite adequately for that either. So but so when we're talking about protecting ourselves, we're talking about a different kind of mask. We're talking about a respirator, which is, as now everybody knows, an N95. We have something we have N95s on order. I am hoping they will be here soon.
We do not know.
It said May 15th is the date they should be shipped out. So hopefully they're coming, but we have a KN90. We have KN95s, which is the Chinese version of an N95, apparently.
I don't know. I read something about it, but I wasn't really clear. What it is. So.
I'm just hoping. I've also seen articles about fraudulent or what's the word I'm looking for? Like
knockoffs.
Knockoffs or counterfeit respirators.
I'm sure they're everywhere. I don't know. We just have to do our best, and we have to wear a mask when we're with people, and any face covering is better than none, I suppose. So, and I wish everybody felt the same way, but we still encounter people that don't. So,
and we have asked our clients to wear masks to the office. We wouldn't expect them to wear masks in labor. I just think that would be really hard. Although I have seen in some hospitals, they are asking it. And I've listened to some podcasts and people are saying, it's actually not that bad because you're in labor and you're so focused on just doing the work of labor that it wasn't as bad as they thought it would be. However, I wouldn't, right now at this point, I wouldn't feel good about it.
Right. And, who knows what could change in the future. But, wearing the mask to the office is really important because you are protecting not only us, but all of the people that come in contact with us, which is a whole bunch of other pregnant people and babies.
Right. I mean, theoretically, and I think this is part of my frustration. So I just want to say up front, I have no patience for the conspiracy theories. None. I don't want to hear them. They hold no weight for me. So there is a certain percentage of providers that I see out there, not just midwives. I've seen it from some chiropractors. I've seen it from some different provider types that clearly are on this ideological, they're in a different ideological place that they do not think this is a real thing. And they're not, or they might think it's a real thing, but either they don't think it's a real thing or they clearly don't understand the potential severity of this. And I've seen some photos on Facebook and people out there not using appropriate PPE and not having, I don't know if I want to say, not having clear expectations for the people that they're working with.
Right. The thing, I've seen this 3 times today. So it must be the new thing that got flipped around. But I've seen 3 different people say it has a 98% survival rate. And so what's the big
By the way,
freaking
that's
deal?
not that good.
That's not that good. That's a 2%
That's a
death
terrible
rate.
case fatality rate.
Yes. Yeah. So this is like a spin on it, but it's like that 2% is a lot of people, and people I know are starting to die. I don't know if that's happening to everybody, but it's happening to a lot of people. So, and those
That's a
people
terrible case fatality
yes,
rate of a virus. I mean,
yeah,
so the people that can't let go of this false flu comparison,
yeah,
I believe, I don't really know, I should have looked it up before, but I believe the case fatality rate of the flu is closer to 0.1%.
mm-hmm.
So
I think that sounds
right?
Sounds like what we've talked about before.
Yeah.
So it's huge, right? And so it's a lot
That's
of people.
10 to 20% higher. Or
a lot of special people that die.
That's, yeah. Not 10 to 20% higher. Hang on. That math was way wrong.
It's many
times thousands of times higher. I'm getting my percentages and my ratios mixed up. Sorry. Hang on. I'm going to do the math. Okay. Let's say that coronavirus has a 1% fatality rate. So that is 0.01, and the flu is 0.0001. It's 100 times higher. So it's 100 to 200 times higher. Yeah, that's bad.
It is bad. So it's illogical, but of course then there's the people that say that it's not true at all anyway, and so it's just very frustrating and disappointing and makes me ashamed to be a human some days.
Yeah, I mean, I just don't even mind saying it right now. I don't even, I think when this all started months ago, we would have been really careful about offending certain groups of people. And right now I'm just going to say, I don't have the patience for this. It is a real thing. If you don't think it's a real thing, you're probably going to want to go find midwives that think it's not a real thing too, because we're going to have guidelines that we expect. Yeah. We cannot put our whole entire practice and our families and ourselves at risk because one person doesn't think it's a real thing. That is just not fair. That's not fair to the rest of the people.
Yes.
So we've added an addendum. Nobody has really had a problem or has verbalized much of a problem with it. We've had pretty good agreement about it, but where we've made it really clear, these are the expectations. Also, we can't attend your birth if you have any symptoms in your household. We don't have perfect PPE. We are not physicians. We're not equipped to deal with infectious disease situations. And there's real risks associated with COVID for, we've seen some clotting concerns. We've seen babies have been sick. It's not, luckily
placental infections,
placental infections. Yeah. Mm-hmm. So it's not a high percentage of the people that are being infected that have these complications, but they're not things that we can appropriately diagnose or manage. So the appropriate place for anybody who's sick is in the hospital where they can deal with these things. So I know it's true. Rough, but it's important to remember that there's a number of reasons that you could end up in the hospital, a number of reasons. It's not just COVID. You could be fatigued. You could have, your water could break and we can't get labor started. That's kind of
anytime you have a fever, anytime you have elevated blood pressure, signs of infection in general,
we could walk in and listen to the baby and they don't sound great. And, we have to just always adapt to what the situation's presenting. Mm-hmm. So
absolutely.
Yeah. What else have you feel like, have you changed or what's been, I don't know, what's evolved in the new world for you?
I don't know. I mean, we're having a little bit of trouble with the social distancing as it goes on. So there's this, it's a combination of we're getting used to it and it's not such a big deal. Mm-hmm. And then you have days where it's really painful because you really want to do whatever it is. You want to go see your friends. You want to go like
Mhm.
one of the kids was going to do figure skating lessons this summer, and that actually was in the spring, and then we're like, maybe in the summer, and then probably
Maybe in
2 years.
2022.
Yes, exactly. And we're worried about all the fun stuff we wanted to do this year, and just like that kind of thing. But for the most part, is in terms of day-to-day life, we're fine. And I was gonna say, we've started going back to doing some necessary medical visits and dental visits. So, and I just want to put it out there that the dental providers, and we had an eye appointment that somebody broke their glasses, of course, in the middle of a pandemic, so we had to go get new
Good
glasses.
timing.
And every single provider that we've had contact with has been really clear about what their expectations are for us to go into their office. And we would not be allowed into their office without a mask, period. And I do not see why any of the healthcare providers, including crunchy midwives such as ourselves, would be any different than that. We should be setting expectations that keep the other people in our practice safe. The end.
I think I mentioned this. I don't remember if I mentioned it on Mod Midwives or if it was just a conversation that we had. Sometimes Mod Midwives just feels like a conversation that we have. Today's Mod Midwives is just going to feel like a conversation. It's funny because Dr. Stu and Bliss have turned their podcast into, they're calling it Fireside Chats now because they're doing the same kind of thing remotely.
Oh, so. That's cute. I like it.
Yeah. Anyway, I recently completed the EMT training with my son. My middle son is really interested in emergency medicine and all of that kind of stuff. And but he struggled. He took his first EMT class really young. He had just barely turned 18 and didn't pass the exam. So we thought, let's take this together. I think that having an accountability partner, having someone to just make it kind of part of your daily things that you talk about, I think that makes it easier to immerse yourself in the world. Anyway, so I took this EMT class with Liam. And the very first thing you learn, literally the first thing you learn, is to protect yourself. And so the first thing you do is you don your PPE, you assess the situation for safety, and you decide whether it's safe for you to continue or not. That is an expectation in the healthcare system. And I think that it's not an expectation for midwives.
It is not. It is not an expectation. We all are elbow deep in people's fluids, and we're comfortable there because we know our people and all of this, but that does not make it okay.
It doesn't make it okay. And we do so many things that are, now that we have this new standard, I realize how many things we've been doing. Like, I'm really curious to see if you're going to take your shoes off at a birth.
Oh my gosh, that is not happening. What? I never take my shoes off.
I mean, your Twitter bio literally says barefoot midwife.
Oh shoot, I'll go change that.
So I'm just saying, there's so many things we're going to have to change. I never like to be barefoot at a birth. I've stepped in too many things with my socks, and I hate gross socks on. So, but what I have been doing is I have a couple pairs of minimalist sneakers that don't have a lot of structure, and I just throw them in the washer with my scrubs when I get home. So I'm washing them. So for people that don't want people with shoes on in their house, at least that I've washed my shoes every time that I've worn them. And I will be wearing shoes. I'm going to wear shoes.
No, we have to wear shoes. And I bought clogs. I bought clogs that I wipe down every time before I go in the house. So
that's a good idea. That's another good option. Clogs twist my ankle. Although I don't know if the Crocs ones would. They probably wouldn't. Did you get Crocs?
No, I don't remember the brand. They're like knockoff Danskos or something.
You saw what happened to me in Danskos. I just randomly, my ankle twists and I fall down in them all the time. It's horrible. That was so embarrassing.
That's awful. Yeah, so
you
gotta wear shoes that are right for your feet.
Yeah, I might be able to, but the Crocs have holes. Do they all have holes? There
No,
might be
no,
some
you can
without
buy
holes.
Crocs
Yeah.
without holes.
Yeah.
But those are good too, because you can wipe them off.
Yeah.
So, and we wear scrubs all the time now too. So you
Mhm.
can't be barefoot with scrubs. That's just that's a silly
Mhm.
look.
Yeah. I had a student that was planning to come stay some time here, and we've been kind of rethinking how we're going to do that. And she probably will be here in June. But it's interesting because our agreement, you have to just sign a clinical practice agreement or clinical training agreement with the school. And in past agreements, I've been like, just dress business casual, blah, blah, blah. Now I'm like scrubs. Like that is all that we wear because we have to wash our clothes in hot water every time
Yep.
that we wear them.
Yep. Yeah.
And I think those things are not going to change for a long time. I think those are the things that are going to become habit.
Yeah, I think so too. I think it's just going to be like that, and it's fine. And it'll it changes the landscape a little bit, but I don't think it's the worst thing in the world to wear scrubs to the office. It's fine.
No, except that I found myself looking at clothes today again.
I know. There is that little, like, I've caught myself several times saying, oh, I need to go buy this. And then, like, I actually don't have any reason to wear any cute clothes.
None. It's so sad.
None. Yes, because even on the rare occasions that I am going to go out to, get something in a store, I'm not wearing something cute. I'm wearing something I can take off and throw in the washer. So.
I'm literally either wearing workout clothes. Today I was going to go for a walk, although, well, maybe I still will. It looks like it was going to rain, but maybe it's not. Anyway, it was I either wear workout clothes or scrubs.
Yep.
Basically it. What else do you want to talk about? Like anything else with?
I don't know. I think just what I was interested in today is just really trying to express how important it is to the other people you encounter to wear face protection and wash your hands and all the things. Even if you think it's dumb, just think about the other people, the immune compromised people, the old people, the young people, the pregnant people, or the people that are going to come in contact with them.
I think it's really important though to mention that this virus is really random. Yes, there are groups with higher percentages, but there are really healthy people just dropping dead.
Yeah,
I mean,
and that's the thing, is I don't even know what it is. It attacks multiple organ systems in different ways, and so of course somebody our age could die. Children have died.
I'm not that young. I mean, this whole thing is like 50 and up. Guess what? I'm 47. I mean, I'm not that far away from an at-risk group. So
I did this thing I didn't complete it, but there was a risk assessment survey going around.
I did that too.
Did you do it?
I was like 78%.
I couldn't push it. I don't know what my results were because
I was like, there's 78% chance you're going to get it. Oh, I wanted to mention that I did do the antibody testing. We have clients who have a functional medicine practice, and they are able to offer the IgG and IgM. IgG detects a past infection, and IgM detects a current infection. We can offer IgG only, although we haven't done it yet, so I don't really know how that's going to work, but I wanted to see the IgM too. And it's really hard to get in. There's a hospital here that's doing it, drive-by testing, but it's hard to schedule. So anyway, my lovely client who was in at an appointment, I said, oh, I found out she could do it. And then I asked her to draw my blood. And she graciously did it, took it back to her office and ran the results. And I was negative. And I haven't been sick. I didn't have any reason to think that I potentially had it.
Yeah.
But I was hopeful because we're talking about that asymptomatic infection.
Yeah, we hope that we had an asymptomatic infection, or that that scratchy throat we had, or that mild cough or whatever was COVID, and then we're done with it, right?
Although I will say I would be a little distressed if I did have an asymptomatic infection, because that means I wouldn't have been quarantined.
Right.
Appropriately.
So you were just running around town giving it to
I mean,
everybody.
they're not running around town doing things.
Yes.
But in clinic, again, I'm wearing a surgical mask in clinic, not a N95. So, one would hope that it would be protective, but I wouldn't want to be in the position of potentially thinking that I'd expose other people.
Did you watch the governor's update when he went to go see the president? Okay. So he says that when you go in there, they've got a rapid test. They test everybody every day that comes in contact with the president. And it's just a twirly swab in the nose. It's not the brain swab. So it was no big deal. And they do it every day and it takes 15 minutes. So that's what we all need. So
I just want to point out, it's infuriating that is the protocol for the White House when they're downplaying the whole infection. If they really don't think it's such a big deal, why are they testing everybody with a rapid test that nobody else has access to except hospitals?
Yeah. We all need access to this test.
I mean, it's infuriating.
It is infuriating.
So yeah, this is the most political we've ever been on Mod Midwives.
Yes.
Hashtag I don't care anymore.
I know, it drives you to insanity, and this is what happened a few years ago, where you start being, you don't care if people unfriend you or don't hire you or anything like that, because it's just maddening. It's absolutely maddening.
It's maddening. And I really want, I don't know who all listens to us. I get messages randomly in email, and sometimes students of mine will say things that, I heard your podcast. I don't know who hears us, but I want this message for birth workers to be loud and clear that you have a big responsibility here, and you are being so irresponsible when you're not displaying appropriate protective measures, and then flaunting that on social media. It's not okay. It's not okay.
Yeah.
And we have had people say to us, I'd really like to work with this doula, but I see that she's not social distancing. I don't think I can hire her. So it is, is this impacting our business? Absolutely. Somebody is going to listen to this and say, that we're not aware of the truth, and
we don't know the truth about the government.
Know the truth about the government, and they're going to not call us and not hire us. I know this is true, but you should also know that if you're not social distancing and you're displaying reckless behavior, you're not getting called to. So I think that's my message. It does not reflect well on you as a health provider. And I wouldn't call somebody who was doing that to assist me at a birth. I wouldn't call them for backup. I wouldn't do it. We have a huge responsibility. This feels like the responsibility when I first became a midwife, and I was like, wow, or when I first thought about becoming a midwife, and I thought that is a lot of responsibility. That exact responsibility is still on our shoulders, and it's COVID now.
It's just a little different than we thought it would be. Yeah. But we have to do everything we can to keep our people safe, and oh my gosh, it's so much.
Yeah. So, and I've also had people say, we really appreciate that you're taking these actions because we feel safer in your care. So
yes,
can't please all the people all the time.
No,
we're going to err on the side of caution.
Yeah.
An abundance of caution, Nedra.
Yes. It's my favorite new thing to say.
And then maybe I was going to say, we talked about what we were doing with water birth in a previous episode. We do have some additional PPE now. We have some gowns. So I think we have a little more protection for ourselves. I think we'll see some evolution of relaxation again, so we had strict things, and I think we'll see some. So there's hope. There's always hope. You can expect that you can absolutely expect us to show up to your house with a mask on when we walk in. You won't see us without it because we'll only take it off in kind of outside settings. We have to figure out how to not get dehydrated and starving with the masks situation.
It's tough.
there's a learning curve there. So you'll probably see us step out to our car. You'll see different things like that happen that maybe we wouldn't normally do, but you might see us in a gown, you'll see us in scrubs, but just know that we're doing it for your protection and our protection. We get to protect ourselves too.
Yeah.
So, all right. That was a little intense, but
it was intense.
Well.
It got intense.
That got real, people.
So I hate to do this, but my phone is ringing and it is
Okay.
one of our clients.
Oh, somebody might be in labor. All right, that's it for Mod Midwives. All right, bye, Nedra. Go ahead and hang up.
Bye.
Everybody else can follow us on social media at Mod Midwives, Instagram, Twitter, Facebook, or you can find us on our regular webpage is www.metromidwifery.com, and you can find our podcast page at www.modmidwives.com. And now that we're doing Zoom, we are also on YouTube pretty consistently for the past few weeks. So thanks for joining us and have a great week.